How does laparoscopy help diagnose stomach cancer? Staging explained. Imagine being able to see inside the body without large cuts or long recovery times. That's what laparoscopy offers when it comes to diagnosing stomach cancer. It is a minimally invasive procedure where a small, lighted tube called a laparoscope is inserted through tiny cuts in the abdomen. This allows doctors to look directly at the organs and surfaces inside the belly, giving them a clear view of what's happening. In stomach cancer diagnosis, laparoscopy is especially useful because it can find cancer spread that might be hidden from other tests. For example, small cancer deposits or tiny metastases on the lining of the abdomen, called the peritoneum, can be missed on scans like CORT or PET scans. Laparoscopy allows doctors to see these small lesions directly, which helps in understanding how far the cancer has spread. During the procedure, the doctor can also perform peritoneal washing. This involves flushing the abdominal cavity with a special fluid and collecting it for lab analysis. Under a microscope, they look for cancer cells floating in the fluid. Finding these cells indicates that the cancer has spread beyond the stomach, which is important for staging the disease. If any suspicious areas are seen during the operation, the surgeon can take small tissue samples called biopsies. These are sent to a lab to confirm whether cancer cells are present. This step helps ensure an accurate diagnosis and guides treatment options. Laparoscopy also helps assess how deeply the tumor has invaded the stomach and whether nearby organs are involved. This is crucial because it influences whether surgery is a good option or if other treatments like chemotherapy should be considered first. Staging is a way of describing how advanced the cancer is, and it uses a system called the TNM classification. The T describes the size and depth of the tumor, the N indicates whether lymph nodes are affected, and the M shows if the cancer has spread to distant parts like the peritoneum. Laparoscopy is especially valuable in detecting M-stage disease, which involves distant spread, because imaging tests can sometimes miss small metastases. The procedure is performed under general anesthesia, with the patient lying on their back. The surgeon inflates the abdomen with carbon dioxide gas to create space to see and work. They carefully examine the liver, diaphragm, spleen, stomach, and the lining of the abdomen. If the tumor is on the back wall of the stomach, they may explore behind the stomach in an area called the lesser sac for a more thorough check. Because laparoscopy is less invasive than open surgery, recovery is quicker, and there is less risk of complications. It provides critical information that helps doctors decide the best course of action. If the laparoscopy shows that the cancer has spread extensively, surgery to remove the stomach might not be helpful, and systemic treatments like chemotherapy may be recommended instead. In summary, laparoscopy is a powerful tool for diagnosing and staging stomach cancer. It allows doctors to see inside the abdomen directly, detect hidden spread, and take tissue samples for confirmation. This helps ensure that patients receive the most appropriate treatment based on an accurate understanding of how far the cancer has advanced. Always consult with healthcare professionals for personalized advice and treatment options.